If your knees hurt when you squat, it's your body's way of telling you something's off. I'm Dr. Sean Liu, your friendly orthopedic surgeon, and here's what I look for in patients reporting squat-related knee pain. Pain in the front of the knee, especially under the kneecap, is usually linked to poor tracking of the patella, weak hips and gluteal muscles, tight ankles or calves, or improper squat form. In many cases, the knee is just the victim in a bigger biomechanical issue. For example, if your ankles can't dorsiflex, your knees move too far forward. If your glutes are weak, your knees collapse inwards during descent. If your form is too narrow or too wide, pressure shifts to the wrong structures. Sometimes, the issue is structural, like chondromalacia or patellar tilt. In those cases, we use imaging, taping, and physio to restore alignment. And sometimes, we might also consider surgery. The fix often starts with adjusting your stance, your footwear, your warm-up, and your mobility work. If pain persists, don't just continue squatting. Get your movement assessed. Every step without pain starts with a decision. Make yours today.